name is Dr. Christopher Hope. I am a board-certified sleep specialist, and I serve as the medical director for the Sleep Disorders Center here at East Alabama Medical Center.
My name is Jana Smith, and I am certified as a family nurse practitioner, and I work here at the Sleep Disorders Center.
A lot of people think that not getting enough sleep can cause you to be just a little tired the next day, but there's growing evidence that repetitively not getting enough sleep or not getting good quality of sleep can really impact your health overall, especially if you're not getting at least 6 hours of good sleep. There's evidence that that can actually increase your risk of having heart complications up to 20%. People who don't get enough sleep are up to 17 times more likely to get into an accident, to have problems with their relationships, problems with work, and it can really impact your health overall. So here we treat a wide variety of sleep disorders, the most common of which is probably obstructive sleep apnea, which is a breathing disorder where you stop breathing or have restrictions of your breathing periodically when you're asleep.
Even if we find that these patients don't have obstructive sleep apnea, there are other things that we can do sometimes to help with their excessive daytime sleepiness or help them fall asleep at night. The main issue that we do see is people who are excessively tired throughout the day, or if it doesn't make a difference, say you were to get 4 hours of sleep and then another night you got 8 hours of sleep, but you feel the exact same way the next day. It doesn't make a difference if you were to get 8 hours versus 4 hours of sleep.
Kind of like having a bad day or a bad mood, having a bad night's sleep can be normal. But once it starts happening frequently, as in most nights of the week, or happening for an especially a long period of time, we generally say more than 3 months, and it's causing you problems during the day, that's when we would say, okay, there's probably something going on. Before coming and seeing me, I would say the first thing to do would be to cut out things that you can change that probably are negatively impacting your sleep. If you're having more than one caffeinated beverage a day, or if you have the TV on or other sources of light or an uncomfortable sleeping environment, those would be the first things I would try to change before you necessarily come and see the doctor. When somebody gets referred or comes in to see us here at the Sleep Center, the first thing they do is most people actually come and see either myself or my nurse practitioner, Jana, for a clinical evaluation. A lot of people just want to go ahead and get the sleep study, but the sleep study really is a very specific test that needs to be tailored for the question of what's going on. So part of that initial evaluation is saying, is there something that a sleep study is likely to pick up on, and should we do it? Or is this regular insomnia, in which case the treatment to that is medication and making changes to your bedtime routines.
For patients who don't get good sleep at night, you really start seeing a decline in not only your mental health, but also your physical health. Sleep is one of those things that we all take for granted. When it works great, you feel great. And then when you start noticing a pattern or change in your sleep where you're not getting good sleep at night, it really can impact everything with your health. So sleep is one of those things that a lot of times if we can make those adjustments there, you'll start feeling a lot better throughout the day.